I've always appreciated healthcare workers, but I have had a whole different outlook on it when my mother stayed in the nursing home here for 10 years. And I appreciated everything that was ever done for her at the nursing home and at this hospital. But when it's you yourself and it's something like that happens and you have a near-death experience, it makes you appreciate and look at them in a different way. I had never been admitted to the hospital in my life, and I was probably as scared as I've ever been. I drove myself, I walked in, and I brought me just what I had to bring, and I was planning on tomorrow I'm gonna be back home, not knowing that a month later would be before I would be back at my house. I knew 90% of the workers here, and 90% of them knew me. And they knew I was scared to death. I came in here with COVID, and I stayed here for 10 days under their care. I was only awake and alert probably the first 3 or 4 days of that. And then they transferred me to ICU, and I was put on a ventilator there. Within that week, they got a room available at AU in Augusta. They were dealing with Dr. Line here in Emanuel Medical through telehealth.
What we're going to do is we're going to follow along with your care, and at any point, you need a service, you need an intervention that can't be provided there in Swainsboro, we'll transfer you. We'll bring you to Augusta. We're following along so we know what's going on with you, we know what you need, and when you get here, we'll be ready for you.
And he felt it best that I needed to be transferred to AU. They finally got a room at AU, and I had to be airlifted there.
These these lab people, these nurses, they wanted the patient to be taken care of. And if it takes rolling a computer in the room and talking to a doctor from Augusta to get this patient taken care of, then that's what we're gonna do.
It probably meant everything in the world. The doctors here were looking to them for guidance and help.
I think that really helped the staff buy in and understand that that was truly a program that was helping our patients, helping them, helping the physicians. So it really went off well.
The strangers and the travel nurses that were at AU, you couldn't have asked for any better. I was unconscious the whole time, except for the last, I don't know, probably 6 or 7 days. And when I woke up, I did not know where I was and didn't know how I got there. But I've asked a million questions since then. But I know it all started here at Emanuel Medical, and had not they given me the care that they gave me and kept me at the level that they did, I probably would not have made it. It all worked out for the best, but it all started here at this hospital, Emanuel Medical.